Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and medical professionals discussing health topics of importance to local residents. We're again back at the new Brunswick Novant Medical Center, which opened in July. Today we will get an inside tour of the hospital's Surgical Services Department, and we'll have the opportunity to meet several local surgeons. Stay tuned for this special sneak peek into the surgical department with Health Watch.
Hi, June.
Hi, Colleen.
How glad to see you.
Oh, it's very
Welcome
nice to see you.
Surgical Services.
Well, thank you. It's a pleasure to be here.
Well, we're going to have an exciting day. We're going to walk through not only the pre-admission area, part of this, and the ambulatory care area, and then I'm going to take you to the OR.
Really?
I am.
Oh, that's exciting.
So-
I can't wait. Well, let's get
Come on
started.
on. Let's get started.
Thank you.
This is our waiting room here.
It's lovely.
It's lovely. It's got a great view outside, so
It does,
people can
yeah.
see the outside and tell what the weather is like out there. We always have volunteers at this desk that's right here, or we have staff members who are there to help you and assist you, answer questions about where you're supposed to go next and what time
Right.
that we're planning the procedures, those kind of things. And they can also relay information back to the surgical team as well. We have a paging system that we use that I'm going to show to you when we get to ACU.
Okay.
It's a beeper system that the patient's family can have. They can go throughout the building, go to
Oh, that's nice.
the cafeteria, to the lovely gift shop, and also be aware of when they're being called back into this area to
Oh,
talk
that's
with
really
the physician.
nice.
So that's
Because it's so important. That communication is so important
It
to our
really
patients
is.
and our families.
It is, and we understand that, they may not want to wait in this area. They may want to get up and walk around a
Right.
bit, and that allows them the freedom to do that.
Well, great.
So we're going to go on to pre-admission testing.
Okay.
I'm also going to make you aware that we have 2 consult rooms that are here that are private.
Okay. And what happens in pre-anesthesia testing?
Each one of these rooms that's behind you is an examination room. And the nurses that are here actually speak with the patients prior to their surgery, answer any questions that they have, explain the whole process, when to arrive, what to expect, what to bring with them. And in fact, go over their orders with them, go over their medications with them, complete essentially a history on them of the patients as they are needed here for our uses and our purposes.
And this is a change from the
This is
old
a change.
facility.
We also do not only interviews with patients, sometimes we call them on the telephone and ask them the questions over
I
the
see.
telephone, especially our outpatients who it's not necessary that they come into the facility. So it saves them a trip to the hospital here, but also the ones that need to come in who are going to be inpatients after their surgery or who are a little bit more complex, and we want to see them and make sure that they understand.
Sure. I see it's a nice private area, too.
It is very private. We do a lot of the documentation by computer, and so that helps hold their record within the facility as well. This is the nurse's station to our right here.
Uh-huh.
Dr. Zub is here.
Hey, Dr. Zub.
Hi,
How are you?
Good.
June Baker.
David Zub.
Nice to meet you.
You too. Hey, Colleen, how
Thank
are you?
you.
Good to see you.
You too.
Thank
Thank
you
you.
for being here.
No problem.
What kind of a physician are you, Dr. Zub, and what do you do here at Brunswick Novant Medical Center?
I'm an interventional pain physician. I see patients over at my clinic at Dr. Circle, and I come over here to do interventional pain procedures and do consultations in the hospital as well.
I see.
Any manner of blocks and whatnot for interventional pain, and then also see folks as inpatient consultations if they have pain that's difficult to control or treat.
Great. How do you like the new facility here?
It's been wonderful. We're very excited about having this facility here. The resources here are amazing.
Is there one particular area of the OR that's really stood out for you that has really made your day?
You know, the extra energy, the extra excitement about having a new facility has been wonderful. You can feel everybody's excitement about just being in this new facility.
Well, is there any message that you would like to get out to our viewers in the community about Novant Medical Center?
just that we're expanding our offering here, and that any questions, feel free to ask any physician or any nurse or any staff here at the hospital. It's a great place to be, and we'll do what we can to help you.
Well, great. Well, it was a pleasure to meet
Yeah,
you.
thank you. You too.
And thank you so much.
Okay, my pleasure.
Thank you.
Okay, we'll let you go back to work now.
Okay.
And we're going to move on to the ambulatory care unit now.
Okay, great.
So,
Thank you.
June, this is now the ambulatory care unit that we have here at Brunswick Novant Medical Center. It's a 20-bed unit, and this is where the patients first come when they're coming to have their procedure done or their surgical intervention done. And I'm going to show you around here. But as I'm looking across from me now, I can see that Dr. Scallion is here, and perhaps he'd have a moment to talk with us.
Great, thanks a lot.
Hey, how you doing, June?
Hey, Dr. Scallion, how are you?
Doing good. Good to see
Very
you.
nice to see you. Tell me, how are you doing here in the new facility? What do you like best about this place?
Well, it's been a great change from our old facility. Everything's new. Everything's modern. We have the latest state-of-the-art equipment. New ORs, new tables, new machines. It's been a great change.
That sounds great. What kind of surgery do you do here at Brunswick Novant Medical Center?
Me personally, or
Yeah, you personally. What do you do here?
well, I'm a general surgeon, so a typical day would involve potentially a wide variety of cases. Removing somebody's gallbladder, a hernia, sometimes breast
So
surgery.
any general
Right.
surgical procedure you would perform here?
Correct.
So it's no longer necessary for folks to travel up the road then?
There's very few cases that would need to travel outside of Brunswick County anymore.
That's great. Great to know. Well, thank you so much for your time. We appreciate that.
You're welcome.
Okay.
Okay.
Let's go on with the tour of this
All
unit
right, I'm
here.
happy to do that.
Good. As I
Great to
mentioned
see you, Dr.
before,
Scallion.
Bye.
This is a 20-bed unit, and each one of them is a private room, which
Wow.
is a wonderful addition to this facility. We also have a physician dictation area, which is right close to the ambulatory care unit's nurses station, where the physicians can actually look at patient information, dictate their charts, and those things. And I see that Dr. Kibler is here. So,
Hey, Colleen.
Dr. Kibler.
Hey, Dr. Kibler, June Baker.
Joe Kibler, pleased to meet you.
Nice to meet you.
Thank you.
How do you like it here?
Oh, we love it. Absolutely.
I bet you
love
do.
It.
It's
Fantastic.
beautiful.
Just reviewing a digital MRI of a patient, and somebody that had a torn tendon of their ankle.
And so you're able to access that
Access right here in
almost
the OR.
anywhere? Wow,
Don't
that's
have to carry any
great.
films with this. Everything's digitized.
Wow, that's great. If you had to pick one thing, what stands out in your mind as a great thing here at Brunswick Novant Medical Center? What would be a...
The one thing would be the quality caring of the staff.
Wow, that's
You
so...
can tell that the staff, when they come to work every morning, enjoy what they do. And if you enjoy what you do a good
You
job.
do a good job.
Yeah.
Yeah, that's great. I'm so glad to hear you say that. And that's a great takeaway for our viewers to hear you say that as a physician. You just...
It's not hard to say.
Right.
It speaks for itself. And Colleen does, all of the staff here just do a
they do.
fantastic job
Thank you.
in providing services for the community.
And tell me a little bit about your office. Now, I understand you're a podiatrist.
Correct.
And I think you have an office right down the road.
Yeah, we have an office in Supply and an office in Leland as well, serving the North Brunswick County. And we provide full foot and ankle surgical techniques, as well as diabetic foot care. We do run a comprehensive diabetic foot clinic.
Oh,
And do
that's
an awful lot
important in this area.
Absolutely. A lot of diabetics, a lot of limb salvage, a lot of patients that end up losing toes and limbs that is unnecessary.
Right.
And we really strive very hard to prevent that from happening. So, and with the care here at the hospital, it's been great. With the staff of the other doctors who are able to help out in those.
Oh, yeah, I never thought about that.
Absolutely. The hospitalists here and on staff are fantastic in managing the patients, and it makes my job easier. It really does.
Well, that's so good to hear. And I'm so glad that you're happy here, that
Yeah,
it
absolutely.
works well for you.
This moving from the other hospital over here has been fantastic, night and day.
Great.
Night and
Great.
day.
Well, it was a pleasure to meet
Thank you.
and I look forward to seeing you again real soon.
Look forward to seeing you too.
Thank you very much.
Thanks, Jen.
Good to see you, Dr. Kibler.
Thanks, Colleen.
You're welcome. June, let's go into one of the ACU rooms that I
Okay.
was telling you about. As I said, they are all private rooms,
Oh, this is so nice.
and they have, each one of them has a flat screen television
Wow.
here,
Uh-huh.
and we can close the doors because it's private. We have curtains that also allow other privacy as well, and each room has a bathroom.
You're kidding.
No, each room has a bathroom, and which is really wonderful. The patients no longer have to go out into the hall to
Right.
use the facilities or to use the restroom, even just to wash their hands
Right.
preoperatively. We have monitoring systems here. Obviously, that we have to monitor some of our patients preoperatively, and we also have all of the necessary equipment here. This is a before surgical area, but we are really prepared for any type of emergency, even if it happened preoperatively or postoperatively, because we also receive our outpatients back into this
Back in this
area
room? Oh.
after surgery. They see the same nursing staff. They get cared for by people who are familiar to them, who
Right.
know their cases. They see them both before the surgery and after the surgery, which is really very good for the patients and families.
Now, how many rooms did you say you had?
We have 20,
And they're all like this.
and they are all like this.
Great.
And we do have some that are in other hallways down this hallway. And I'm going to take you now to the area that's right across from endoscopy suite that we have here.
Okay. Before we leave, I want to ask you
Okay,
one question. I know
certainly.
you see you have this really nice chair here, and are the family members allowed to stay in the room with the patient?
Good question, June, because oftentimes the families, if it's going to be a short surgical procedure,
Uh-huh.
or if the family needs to rest quite a bit while they're here as well, we can oftentimes allow them to stay in the same room.
Great.
And that way a lot of them read, they may want to watch television, may need to make some phone calls, and just be comfortable not only in this wonderful chair that we have here, we also have rooms that have different chairs in them. We have a telephone that's behind you so that you
Oh, yeah.
they can use that if their cell phone is not working within the
Oh, I
facility.
never even thought of that.
Or
Yeah.
if, sometimes we all forget to charge our batteries a little
Right,
bit,
yeah.
or we use them a lot, so we do have a phone in each one of the
good.
rooms as well. So great
Well,
questions.
this is really nice. I
Thank
am
you.
really impressed.
It's really a lovely facility.
It is. Okay, and we're going where? Now where are we going?
Now we are going to go to our right again.
Okay.
And we are going to go into the area which includes more ACU rooms. It also involves, as we go down this hall, we are going to go into the endoscopy area.
Okay.
We have one suite here. This is one of the rooms I'm actually not going to walk you into, June.
Oh, okay.
It is not, as we consider, a red line part of our operating room suites, but it is a procedure room.
I
And so
see.
we keep it very clean, very safe. Only patients and staff come into this area. So I'm just going to open the door a little bit. You
And let me peek,
And
right?
let you peek inside. But just know that we have anesthesia machines in here. We have all of our video equipment in here. It's very patient-oriented. But for patient safety, we really don't allow other
Right.
people in
Oh,
here.
I totally understand
So-
that. And now this is where a colonoscopy would be performed?
This is where the
or an
colonoscopies, endoscopies are done here, colonoscopies are done in this
Okay.
suite. What I wanted to show you is the proximity to across the hall that is right here is that we have patient rooms. So, and these are ACU rooms, like we were in
Like
the
we-
room previously, and all of these rooms in this hallway here, we save for these patients who are coming in here.
Oh, that's nice.
It is very nice to just come from across the hall on your stretcher and come into this into this area, and then be taken back out into
And you
this
would
area.
recover
Correct,
in that
and then
room.
the patient is recovered in that area
Great.
as well.
Wow, that is
so
so nice.
very close to the physician and anesthesia who is
Right.
taking care of you, and thus it's a very convenient area for the patients and the staff as well.
Great.
So now I'm
Okay.
going to get you put into your bunny suit.
Okay, I'm
So
excited.
that
Let's
we can go actually into the OR, which is a very protected area.
go. Okay, I'm
So
excited.
We will be headed that way.
Okay.